Welcome everybody to the collaborative session. It's good to be with you all. I hope that you are having an excellent start to the week. Let's dive in. So as a reminder, this is recording, and so you'll get access to this afterwards, along with the slide deck with everything referenced, all the materials, etc. Next slide. Housekeeping, I think we all know the drill by now, but let's go ahead and update our names on Zoom and include the name of your organization. That helps us a lot with tracking who's attended, but also in you all being able to follow up with each other afterwards to continue peer-to-peer work and just getting to know each other. As a reminder, I'm Ashley Maloof-Gashow from the Gashow Group. And what is your favorite summer activity? Anyone else wake up today thinking about that song? Summer, summer, summertime. I woke up thinking about that. What's your favorite summertime activity? Go ahead and drop it in the chat. And feel free to use the chat throughout the whole meeting, of course. Fishing, sleep, I hear that, John. Traveling, yes. Waiting for winter. Hiking, wonderful. All right. Anybody who is new to the collaborative, we want to welcome you. This has been launched to really fundamentally improve how healthcare is administered in the state of California. And we are the first state doing this. And so the nation is really looking upon us to see how that goes. And we have an opportunity to really redefine things. It's a pretty amazing moment we're in. This specifically is a space for stakeholders who are directly impacted to collaborate together, to identify challenges, and to problem solve. So it's really an outcomes-driven space. Welcome aboard. You are going to have access to this hyperlinked folder, which has all the materials from past sessions, and we'll have all the materials from today. And if you are new and feel comfortable, go ahead and put your name in the chat so we can give you a warm welcome. I promise we won't embarrass you this time. I'm just kidding. All right, next. All right, so what does success look like for today? We're going to understand what DHCS is doing in response to your CalAIM needs, okay? So the collaborative spaces across the state are working. The issues that you all are really helping to lift up are being heard, and responses are being delivered. So we're going to hear what some of those responses are. We're going to understand DHCS's new Justice Involved initiative and how it impacts your organization. Want to make sure that you know how to access the coordinated entry system to improve housing coordination, and also to receive best practices and process recommendations in order to continue to launch your PDSAs, which are really your plans for how to move things that are currently identified as an issue or a pain point for you into a plan to alleviate those. Any questions about any of that so far? All right, let's keep going. So here's how we're going to spend our time today. We're going to hear updates from DHCS. Woo-hoo, thank you. We're appreciative. And today's session really marks the midpoint of our work together. Time is flying. And again, based on the needs you've identified, DHCS is working on statewide policy solutions to mediate the issues that you are facing. So this is exactly how it's supposed to work, right? This is set up as a space to collectively give input, and DHCS is responding to that input with solutions. So can we get some celebration emojis? Yes. All right, part 2 is going to be knowledge sharing. HealthNet and Health Plan of San Joaquin are going to share information on the new ECM Justice Involved initiative and also coordinated entry system for housing coordination. Much appreciation to the plans for being here and for being here regularly to provide in the moment TA support, answering questions. It's such a game changer having you all here. And then part 3 is implementation breakouts. We're going to do this a little bit differently than in the past, and we'll talk about that more later in the agenda. Next slide. Pass it to you, Alexis.
Hey, everyone. So I have to be very childish at the moment and say that when we were discussing summertime activities, I stated fishing because I have like this newfound love for fishing since we live right next to a lake now. But then I saw John's response that said sleeping. So I just want to say that I'm really jealous of that. And I'm going to, plus that on my end. Going back to what Ashlyn was saying earlier about just being like so welcoming of anyone that is new to the collaborative, super appreciate everyone being on this call today. We understand everyone is super low capacity. So being able to make, time out of your day to join us to thought partner and plan on how to change quite literally California is just immensely valued and so appreciated. Ashlyn stated, we have some updates. And so we can go to the next slide. I have been excited to be able to share these updates that we just received from DHCS. The reason being, at the top of this collaborative, we all got together for the first time back in January. And, individuals uplifted, like we're experiencing like these issues in real time and we need solutions sooner than later. And so we committed to being like very action oriented, making sure that we were uplifting like these very important needs like to the state. So that way we could start to inform those solutions. And so we have like some amazing feedback. And before we even dive into that feedback, I just have to emphasize that had it not been for your participation in these meetings every single month, we would not have had like such good feedback and insight to uplift. So major kudos, so many thanks. And let's dive into like what exactly is happening right now. So number one, DHCS is listening, okay? So at a high level, we all know we've been coming together every single month as CalAIM stakeholders to chronicle issues and uplift recommendations in order for us to improve CalAIM implementation. That is also going to include the Justice Involved initiative that's coming online, the children and youth, population of focus that's coming online, birth equity population of focus, so on and so forth. And so the state has wanted to know how you're doing, what have you said, what's going on the ground. And some of the ways that they have collected this information is from data submitted directly from the managed care plans, interviews, surveys, some stakeholder advisory groups, and very importantly, DHCS listening tours. So in April, we were able to have an in-person meeting with DHCS for us to say, hey, this is what's going on the ground. These are the issues that are being experienced, and these are the proposed solutions. And as a part of that, we've been chronicling those systems-wide solutions so we can continue to uplift those. We go to the next slide. DHCS went from listening to planning. So just this month, recall, I just said we had that meeting with DHCS in April. However, just this month in June, they shared that they are using CPI as one of the 4 most learning sources for being able to identify CalAIM issues and solutions. And based off of all of the feedback that you all have provided, they're coming up with a 5-point strategic plan. So this strategic plan is going to issue statewide guidance surrounding standardizing eligibility, streamlining and standardizing referrals and authorizations, the processes and the systems, improving data exchange, strengthening market awareness. I know that's something that we talked about a lot regarding referrals capacity, being able to increase CalAIM awareness. We have been working on our own awareness campaign as a collaborative. We just launched that last month. And then lastly, expanding the provider network and streamlining payments. So what does this look like? If we go to the next slide, we know that DHCS is planning, but they're also acting. So we have these, 5 core areas that they are starting to like aggregate information on so that the way that they can act with policy recommendations. And so these statewide policy recommendations are going to start to be executed as early as July because of the sensitivity of the issues, right? Because of how important, the feedback and issues that have been uplifted are. And so just to give you a little taste, like at a very high level of some of those policy recommendations that are coming down the pipeline, they're going to address variations in eligibility criteria in order to increase enrollment. They are aware of the low awareness of, ECM and NCS community benefits. So they're going to provide guidance and information on forthcoming awareness campaigns. They are now aware of non-payment and delayed payments and inconsistent reimbursement for ECM. So they're going to be able to come forward with additional guidance surrounding that. They're going to come forward with guidance surrounding expanding the provider network and the types of providers that they want to tap into further, for example, community-based organizations, to make sure that we're expanding the network, but expanding in a very strategic way. Improving data exchange, and then most importantly, something that this collaborative has been very keen about is being able to introduce and have conversations surrounding streamline and standardize referrals and authorization processes, being able to have synchronization like across plans, right? And so I've been super excited that, we were able to take all this information back to the state that you all have flagged and uplifted, and that this is where we are now. This is like amazing progress. So thankful and so excited. We're going to have a Q&A later on once we hit our breakout rooms, just to like dive a little further into like what this could like and potential opportunities for providers to inform, those policies. If we go to the next slide very quickly, we were only able to do this because you all have been like so vocal about what your needs are. So the next steps would be for you to make sure you continue attending sessions, because in sessions 7 and 8, we're going to be able to talk about the actual policies, since those policies are going to be coming down, and the actual next steps and how they're going to solicit feedback from providers. So in session 7 and 8, we'll be able to translate, those next steps directly from the state, so we can figure out how we incorporate that into our goals. And then secondly, please complete, like I know everyone's received this email about the CPI survey. The state wants to know, like, how are we as your facilitators doing? Are we capturing like your issues correctly? Are we working towards solutioning? Are we engaging you? So please, like, be honest, complete the survey. We're going to make sure that we get this deck out to you with all the materials from today's session, and just make sure that you give us the feedback that we need, so that we can continue like being very like progressive like in this process. All of that being said, we're going to have a Q&A on that in the breakout rooms later on, and we can go to the next slide so I can pass it over to our plan partners. Today, our participants are going to learn about the new Justice Involved initiative that's coming online and how that impacts you. And then also we're going to have an educational spotlight on the coordinated entry system. And I can go ahead and pass it over to our plan partners.
Good afternoon, everyone. My name is Eliana Arguez. I'm a program manager here at HealthNet. I will be guiding you through the first initiative, and we will be including a plan partner. We'll be continuing the presentation. Questions regarding the presentation, it is very hefty, so I will come up. Please put them in the chat and we can address them later. We will be sharing the deck with you with all this fruitful information in regards to the guidelines that we currently have, and as we expect the final guidance as well. I think I can change it, right? Or maybe we go to the next slide. There you go. So the Justice Involved initiative. Presentation.
Oh, sorry, Eliana. I think that we're having some connectivity issues.
Oh no.
I'm
so gonna turn my camera off.
Yeah, that will work perfect. Yeah.
Okay. This is better, or if we need Nayeli to jump. Can you hear me better now?
I think it's still going a little bit in and out. Nayeli, would you be comfortable with going ahead and jumping in a little bit early? I'm sorry about that.
Can you hear me all right now?
Yes, we can.
Okay, great. Hello, everybody. I'm Nancy Reddy. I'm Director of Special Projects Operations at Health Plan San Joaquin. Good to see you all, and thank you again for joining. I'll go ahead and Alexis, have you control the slides if you don't mind, or your staff?
Yep, that works perfectly. Shiva, you can go ahead and progress as they need.
Great. Great. Thank you, everybody, for joining. So on this specific slide, we have the ECM populations of focus. I think this is a really good snapshot of all the different populations of focus that have gone live between adults and children. And our focus today at the CPI meeting is to focus on adults as well as children and youth that are moving out of incarceration. So the justice involved population that falls under for both adults and children and youth. So as you can see, this grid kind of shows exactly where all of our populations of focus lie between the adults and children and youth. Next slide. Great. So again, here is some eligibility criteria. This is specific to adults transitioning from incarceration. So adults who are transitioning from a correctional facility, and correctional facility meaning a prison, jail, or youth correctional facility, or transition from correctional facility within the past 12 months. That's one part of the definition. The second part must have at least one of the following conditions: mental illness, SUD, chronic condition or significant clinical condition, IDD, TBI, which is also known as traumatic brain injury, HIV/AIDS, pregnancy, or postpartum. These specific eligibility criteria align with the eligibility criteria for targeted pre-release services that will be available to members in correctional facilities, as requested in California's 1115 demonstration amendment and renewal application. So members who receive pre-release Medi-Cal services will be eligible to receive ECM until reassessment is conducted by the MCP, which is either Health Net or Health Plan San Joaquin within Stanislaus as well as San Joaquin counties, which may occur up to 6 months after release. So again, that's the eligibility criteria for adults that are transitioning from incarceration from a pre-release eligibility criteria. Next. This is the eligibility criteria for the children and youth that are transitioning from a youth correctional facilities. Those children and youth are transitioning from a youth correctional facility or transition from being in a youth correctional facility within the past 12 months. And again, this is really key to take note of. No further criteria are required to be met for children and youth to qualify for this ECM population of focus. And I know many of you ask me quite a bit, what is the definition of adults versus children and youth? So here on the right end of the slide deck here, adults are defined as an individual who is 21 years of age or older, and children and youth is defined as an individual up to age 21, which means that children and youth definitions for ECM apply up to the age of 21. Regarding the California's 1115 waiver, so in California, we are the first state in the nation to get federal approval to provide pre-release services. So just to let you know that there's going to be pre-release services and post-release services. DMHC and actually DHCS has provided Justice Involved a draft operational guidance. So again, a lot of these materials, a lot of the information we are sharing today is just in draft form, and we're waiting for the final information to be shared before we kind of, go into broader depth about it. So here, as you can see, pre-release services. So prior to HHS's release of guidance, 14 other states submitted the 1115 demonstration, and it requests to provide pre-release services to justice-involved populations. What we received is federal approval. Through this CalAIM 1115 demonstration, California received federal approval to provide a target set of Medi-Cal services to youth and adults in state prisons, county jails, and youth correctional facilities for up to 9 days prior to their release. So that's really the summary or really spotlight on the 1115 waiver. Next. There are quite a few initiative goals, but as part of this waiver demonstration, we want to focus, well, actually DHCS hopes to achieve the following, and us as collaborative partners really want to achieve the following: advance health equity, improve health outcomes, and serve as a model for the rest of the nation. Again, California is the first state, right, to receive this approval for this initiative. And we hope that we're able to provide blueprints or goals or, health successes to show dozen other additional states with pending justice involved 1115 waivers, what we have done to make this successful as Californians. Next. I found this puzzle piece really, really wonderful, and I'm so glad that DHCS is allowing us to share this with you folks. So CalAIM Justice Involved Initiative support justice involved individuals by providing key services in a pre-release environment, enrolling them in, using behavioral health linkages and connecting them with behavioral health, social services, and other providers that can support their reentry. So if you can see that there is a 90-day pre-release service, and this includes pre-release Medi-Cal application process, as well as behavioral health linkages. All of the pre-release period, or that 90-day pre-release period, are going to be covered through fee-for-service. So again, many of the managed care plans, the correctional facilities, those that are working with the justice involved need to just ensure that or be able to acknowledge that these services delivered in the pre-release period are covered through FFS. Now, as we move forward through warm handoffs, we'll learn more later about warm handoffs. This is where we'll do a warm handoff, or from the pre-release to the post-release. This is where enhanced care management and community support providers will work together to ensure re-entry and transition to these members into the community. Within these service delivery models, under the post-release, those will be covered under the managed care. So again, HealthNet and Health Plan San Joaquin will be covering post-release services under the ECM and community support providers through these warm handoffs. So under the pre-release services, these are authorized under the Justice Involved Reentry Initiative. And here are some of the information that would be useful to many of you providers. In terms of reentry, we need to make sure that some pre-release services are included as part of the reentry. That would be case management services, making sure justice involved members receive the physical and behavioral health clinical consultation services provided through telehealth or in person, to ensure that we diagnose specific health conditions, provide the necessary treatment, support pre-release case managers in the development of post-release treatment plans, and of course, discharge planning. Some other pre-release services that are going to be included are laboratory and radiology services, medications and medication administration, medications for addiction treatment, also known as MAT, for all Food and Drug Administration approved medications, counseling, and of course, services provided by community health workers with lived experiences. Another thing to point here at the bottom of the slide, qualifying members will also receive covered outpatient prescribed medications and over-the-counter drugs at a minimum of a 30-day supply or as clinically appropriate. And another item is durable medical equipment, also known as DME. They will have this as a service upon release that will be part of the pre-release services as part of the reentry initiative. Next. So again, we talked a little bit about eligibility earlier in this presentation, and here are some pre-release services for individuals who meet that pre-release access screening criteria. So again, to be Medi-Cal eligible as well as CHIP eligibility, this is of course for the young, adults, parents would fall under this umbrella, youth under 19, pregnant or postpartum, those that are aged, blind, disabled, current children and youth in foster care, and former foster care youth up to age 26. And under the CHIP program, the eligibility is youth under 19 and or pregnant or postpartum. And again, we talked about criteria specific for pre-release Medi-Cal services. So again, in order for incarcerated individuals, they must meet the following criteria to receive in-reach services. So I talked to you a little bit about the Medicaid or CHIP eligibility, so they must be part of that group, and they must meet one of the following healthcare needed criteria. This is specific for adults. As I mentioned before, mental illness, substance use disorder, also known as SUD, any chronic conditions, intellectual developmental disabilities, also known as IDD, traumatic brain injury, and HIV/AIDS or pregnant or postpartum. So just keep this in the back of your mind in terms of eligibility requirements for pre-release. So we're going to do an audience poll. It's actually a live poll. So I'm going to have the SPI team, kind of coordinate. We're pulling out the live poll. So again, this is for correctional facilities that are joined today. Hopefully you all have joined and received the invitation. Please provide or outsource for, or do you provide or outsource for pre-release services such as case management or behavioral health in the jails? So we really want to know what correctional facilities do currently in terms of providing these type of services, pre-release services. So please feel free to complete the live poll and submit your answer. And I know that there's some questions that are coming in, but we'll take that momentarily. Great, so 60% has stated that we provide or outsource pre-release services, and 40% no, we do not provide or outsource pre-release services. Okay, good to know. And then we also, do you mind going back really quick? Because now that we've received the answers to this poll, what would be very useful for the managed care plans, if you could drop the name of the community-based organization or county agencies that are currently providing pre-release services, and if you outsource, that would be great. That's just going to be very useful information as we start planning the implementation of pre-release as well as post-release. Thank you. We can go on to the next slide. So these are some information in terms of ECM enrollment, in terms of what correctional facilities will be responsible for. So correctional facilities will be responsible for assigning a pre-release care management provider to these individuals. So this pre-release care manager will either become the individual's post-release ECM provider. So that's one option. And then of course, as I mentioned before, the warm handoff. They will be the ones, that care manager, to initiate a warm handoff prior to release with the care manager that will become the lead care manager, also like the lead care ECM provider, if the correctional facility leverages an embedded care management model. So again, we need to work, or we are planning to work, the MCPs. We're planning hopefully soon to set up, collaboratives within the county with correctional facilities, jails, and so forth, to start discussions in terms of how we're going to handle case management services, what's going to be provided, how we're going to do the warm handoff. DHCS encourages MCPs and correctional facilities to collaborate as appropriate on a county-specific process to determine the appropriate ECM provider assignment for each member. This is going to be really important for correctional facilities and MCPs to really just collaborate, make sure that we have the processes in place to ensure seamless processes as well as provider assignment, and so forth. And that's why MCPs are working diligently to enhance their provider directory to identify a JIECM provider to serve this individual. So that way, in a provider directory, you're able to provide or produce a search tool where you can kind of pull together JI-specific ECM providers. The correctional facility may also seek assistance from MCPs, especially if the individual's MCP assignment is already known. Provider assignment requirements for individuals releasing to different county than correctional facilities. So this is an important item. Correctional facilities must assign a pre-release in reach care management post-release ECM provider that works in the county of residence listed in the meds. If this provider is located in a different county than the correctional facility, pre-release services, including the warm handoff, may be conducted through a telehealth process. Correctional facilities from out of county may reach out to the MCP contact in the county of release for assistance. So again, we need to make sure that both MCPs have a strong provider directory to identify and assign pre-release care management and post-release ECM providers, and making sure that it's continuity of care, making sure that we have a seamless process identified and followed. So again, we need to really, just like I mentioned before, my last word, supporting transition to managed care. So the MCP must support pre-release care management providers and ECM providers with a basic reentry care plan for those who will be enrolled into managed care upon release. So MCPs must have a process in place, A, to receive member data from the correctional facilities, 2, to receive reentry care plan as part of the warm handoff. So again, these collaboratives are really critical to make sure that we have these processes in place. We need to also ensure that MCPs work with the member's ECM provider to ensure we conduct and ensure a seamless warm handoff, make sure that we have the behavioral health linkages in process. That includes any transition meetings, warm handoffs, and any follow-up planning. Schedule community-based services, that includes physical, behavioral health, and social service appointments. Connect a member to a community support service provider. Of course, HealthNet, as well as Health Plan San Joaquin, as you know, offers an array of community support that is for these members. And of course, set up non-emergency medical transportation, also known as NEMT, to post-release services, including on the day of release. So we need to make sure all of these are in place by 1/1/24 for transitions from incarceration.
Well, I'm going.
Post-release ECM service. So once a JI individual enrolled in Medi-Cal is released into the community, we as the MCP plan is responsible for ensuring timely access to ECM services and that their re-entry plan is executed. And again, the theme of continuity of care. Reminder, MCP enrollment is going to be on the day of release. So managed care plans must begin and should begin to provide ECM services as soon as the individual re-enters the community. Some of these requirements include ensure that the ECM services become available the day of release or as close to the day of release as possible. So therefore, we need to work very diligently with correctional facilities to make sure that we have that date of release or as close to the date of release acknowledged. MCPs must ensure that ECM providers meet the JI individual within 1 to 2 days of release. MCPs must ensure that ECM providers conduct a second follow-up appointment with recently released individuals within 1 week of release to ensure continuity of care. And as a best practice from DHCS, they recommend ECM providers should meet individuals at the day of release. In terms of care management planning, all ECM providers must develop a very strong and robust care management plan for the members that they serve. For JI individuals, the re-entry care plan is really critical, and it is part of the pre-release period and will become a very crucial document as we move forward with the post-release, during the post-release period. So we, as an ECM provider, they really need to reassess the members' progress, change in their needs on an ongoing basis, reevaluate this care plan, and making sure that we consistently look back and look at the care management plan to make sure that we ensure that we manage the members' progress. The ECM care management provider must ensure that the re-entry care plan reflects all care management plan requirements described in the ECM policy guide. And I'm sure DHCS will, once it's been finalized, the operational guide, there'll be more detail in terms of that care management plan requirement. Moving forward. Here we have another audience poll. Here's the chat poll. Do we know any organizations that provide post-release, also known as re-entry services currently? And drop the name of the organization directly in the chat. So really, I don't think there'll be a chat pop-up, but if you think of any organizations in Stanislaus or San Joaquin counties that provide post-release, also known as re-entry services, please let us know. That would be great as we collaborate and put this list together to assist MCPs from defining the processes going forward. Thank you, Natasha. Okay, I'll give folks another minute or two. And I want to be mindful of our time. I know we only have till 4 or so, and I know CPI team has some agenda items as well that they wanted to work through. So we'll move forward. Network development. This is really critical, and many of you are ECM community support providers, as well as we've invited some stakeholders from the managed care plan. So the following policies promote continuity of care in the pre and post-release periods and require cross MCP collaboration to execute. So as you know, HealthNet and Health Plan San Joaquin have been doing a lot of county collaboratives together. And this is one of the main reasons. We want to make sure that we have a good, strong network development in process. Providers must meet minimum requirements. That's one of the key items. And MCPs must pursue a network overlap. And we need to ensure network sufficiency. So these are really critical for the pre and post-release periods. This is a lot of information to kind of, share. On the left side, there are requirements that apply to all ECM providers. So I will have the ECM providers that are currently on the call today to just kind of look through this, really enroll through a state level Medi-Cal enrollment pathway, have experience serving the population of focus, have the capacity, have formal agreements and processes in place. I'm just kind of pulling out some themes here. Have expertise in providing core ECM-like services, be able to submit claims for the provision of ECM-related services. On the right side, this is additional JI-ECM provider requirements, and I wanted to kind of pop out one of the best practices that DHCS has kind of popped out here. MCP should prioritize contracting with JI-ECM providers that employ individuals with lived experiences, including community health workers. So again, this is not a requirement, but this is just a shared best practice. I also wanted to, I attended one of the summits recently at from DHCS, and this was a little interesting note. If correctional facilities use the in-reach model versus the embedded model. So in-reach is when a lead care manager must be the same person as the pre-release care management provider. So that's the in-reach model. The embedded model is where the lead care manager must conduct a warm handoff with the pre-release care manager during the pre-release period. So think about what type of model you as correctional facilities fall into, in-reach or embedded. Okay, does anybody want to take CPI or HealthNet want to take the funding opportunities here?
Yeah, I can just do a very quick to just uplift. We know that in the past, we have strongly encouraged our CS and ECM providers to go ahead and apply for IPP and cited funding opportunities. And for JI stakeholders, there also are funding opportunities that are provided by DHCS. And so we're just going to make sure that the hyperlinks are available in our follow-up email. Those funding opportunities are specifically for our county behavioral health agencies, and then also justice involved agencies such as county sheriff's offices, county probation offices, and CDCRs, specifically because in the same capacity that CS and ECM providers have needed to build up that capacity, DHCS also identified that those specific stakeholders would need to build up the capacity to participate in the JI initiative. And so we'll just make sure that you have the links to those funding opportunities to dive deeper into those in the follow-up email that we send out. And I know that that was a lot of information for everyone to process. Nayade, thank you so incredibly much for presenting it in such a clear and easy to digest manner. I know that we are at time for the knowledge sharing section. So I wanted to know, like, would it be too much to truncate like the CES into a couple of minutes, or do you think we should maybe send that information out separately? And then for everyone that has questions, we're going to dive into breakout rooms to be able to address those questions right now. But yeah, just thinking through like, what do you think the best approach would be for the CES?
Mind if I just do a quick spotlight on it? Very
Yeah,
quick.
definitely.
It would be great.
Perfect. All right.
I'll take only a minute or two.
Oh, no problem. Yeah, and you can totally just let us know how to advance through the slides.
Absolutely. Okay, so this is the coordinated entry system, also known as CES. It's just really an educational spotlight just to remind folks what the coordinated entry system, both San Joaquin as well as Stanislaus do have CES lead agencies, and we just wanted to just provide just educational spotlight on this. If we can move forward. So again, HealthNet as well as Health Plan San Joaquin are working on the HIP program, Housing and Homelessness Incentive Program. And one of the key items that we need to focus on is the connection and integration with the local coordinated entry system. And that is one of our key measurements as health plans to be part of this incentive program. If we can move forward. Okay, so really coordinated entry is a consistent community-wide process to match people experiencing homelessness or at risk of homelessness to community resources. It's really the no wrong dorm model. It's a tool that is designed to ensure that homeless folks or persons at risk of homelessness are matched as quickly as possible to end their homelessness. Some of the goals that I wanted to showcase here is to increase the efficiency of local crisis response systems, help communities prioritize people who are in most need of assistance and allocate their current resources, and improve the ease of access to all resources. Some of the, I wanted to call out some of the 4 phases of coordinated entry. And again, many of the counties define it differently, but again, there's going to be an assessment part of it. That's where the standardized assessment and information entered into the Homeless Management Information System, also known as HMIS. Another phase is the housing match and prioritization, documentation and housing navigation, and of course, our goal of housing placement, where the client successfully moves in. Next. What is the intent of CES? It allows anyone who needs assistance to know where to go to get the right assistance. It allows anyone to be assessed and get connected with the housing services that best fit their needs. Ensure clients gain access as efficiently and effectively as possible, such as receiving immediate and long-term housing needs, and ensure that people who have been homeless for a long period of time have priority access to resources. Next. So really, I kind of put into 3 buckets, but really I just wanted to collaborate. We, as MCPs, we communicate, collaborate, the counties have created this coordinated entry system to coordinate the intake, assessment, and referral process within the continuum of care and efficiently expand the system's ability to deliver the appropriate resources to individuals and families who are experiencing homelessness. County CES and HMIS leads, I do want to call out, they've been outstanding partners. That's the Central Valley Low-Income Housing in San Joaquin and the Community Services Agency in Stanislaus. So keep that in mind. There are county CES and HMIS leads. Next. Again, it's really working. There are many ways to get the community and community engagement. Again, getting this kind of community or these type of participants in the community queue, that's those that are staying in a shelter. We can contact through street outreach efforts. Family resource or referral center is also a reference or a referral process where they can look for a permanent housing provider. They can visit the local access center. I know that that's being built in Stanislaus. And of course, engagement and outreach teams and COC service providers. Next. I also want to call out that each county does have their specific CES policies and procedures on their website. So feel free to go to the CES and HMIS lead agencies within your county to review some of the policies and procedures. Some of the key players, this again ranges between counties. They could be CES leads. They handle day-to-day operations and overall intake, initial intake, identification of housing availability, and identify forwards any barriers. I talked to you a little bit about homeless management information system. HealthNet as well as Health Plan San Joaquin both have now access to the HMIS system. This oversees the administration of the system and provides staffing for the process and user training. So we all have been receiving user training and access, and these HMIS lead agencies basically oversee and provide the system and a way to, input that information. You have housing assessors, housing navigators, housing providers, and housing specialists. And I know many of you on this call are currently ECM housing providers. So thank you for joining this collaborative today. Next. And I think I'll pass that along. Hopefully that was quick enough, Alexis and team.
Thank you so much for all of that really important and rich information. Appreciate you. Want to remind folks that we do have office hours, and that's a great place to follow up with any specific Q&A you have. We are a little bit short on time in our breakout rooms, so we will have a couple minutes for questions, but also mark these dates. The Zoom link is here in the slide deck that you all will receive. And let's have a good office hour session. Next slide. Get that. Clearly my Siri didn't get that. Okay, next slide. So let's talk about what's going to happen in our breakout rooms. We've been talking about journey mapping. And journey map this on the web. Oh, Siri. And journey mapping is really about process, perspective, and layers. Okay. So much like we have two beautiful faces here on this image, the eyes, the nose, the mouth, eyebrows, they have these features in common, and yet they look different and they have nuance to them, okay? But all journey maps include a process, which is really outlining a process from beginning to end. It holds a specific perspective. So if we're taking a process from beginning to end, it can map the provider's perspective. It can map the client's perspective. Let's imagine you're buying a house and you had a journey map for buying a house, right? It lays out that process from beginning to end from the perspective of a buyer, from a real estate agent, et cetera, okay? So we have the process beginning to end. We have it from a specific perspective, and then we begin to add in layers around what are pain points? What's an area that like we keep bumping up against? So let's imagine we're buying a house. And one of the areas we keep bumping up against is how to get approved for a loan, right? We would want to document that as a pain point. Also want to document solutions. What allows for the breakthroughs past that pain point, right? So you all remember before, barrier busting, barrier what? Barrier busting. Yes. Alexis, it's cheesy with me. I appreciate it. Yes. Okay, so we're going to continue this journey mapping process today. Next slide. Just to illustrate a little bit of what I just spoke about, here's an example of a journey map. So it's outlining the process of serving a member from the provider's perspective, okay? So what does it have? It has process and it has perspective, okay? And you see here it's laid out in 6 steps. The member is referred, outreach happens, enrollment, authorization, services are rendered, and a claim is submitted, okay? So it's laying out this process from a provider perspective. Next slide. And then this begins to lay out in those 6 steps, where are the pain points? Okay, so on this, where are the pain points? Referrals, authorization, and claims, right? Especially claims is looking pretty heavy, Okay, so this is an example of, this helps us identify, this is where we really need to do barrier busting, right? This is why this collaborative is together, to really understand what are some of the pain points and how do we break through that to make things more efficient and streamlined so that people receive the best care possible in the most efficient way. Next slide. Okay, so we're going to move into breakout room discussions. A number of participants here have moved into the implementation group. So when we first started this collaborative, they were seeking a contract. They have now been contracted. Okay, so let's give emoji celebrations for that. That's a really great marker of success. It also means that breaking out, thank you for those emojis. It also means that it makes more sense to break out into two groups that will have majority contracted folks in each group, but we'll also have some pre-contracted or uncontracted folks in each group. So here's what breakout rooms are going to look like today. We're going to have a few minutes for Q&A because we had a lot of updates today. So we're going to do some Q&A. We're going to discuss key actions. So we've done some work on the journey mapping together. We mapped out pain points together. And now some work has been done to offer some solutions or breakthroughs to those pain points. Want to get your response to those today. Are those right? Do they work? Okay. We're going to discuss your plans. So the plan, do, study, act, which is really about what is it that you want to take action on or you are taking action on. And of course, peer-to-peer support. So we want to make sure there's opportunity to ask questions, support success modeling and education to each other. So we got a pretty packed agenda in our breakout rooms. We will see how far we get. Quality is what matters most. So we will move at the pace that our breakout rooms need. Any questions? Just kidding. If you have a question, ask in your breakout room.
Everyone. We are back. We are back. We are back. So we are just waiting for some of our other friends from the other rooms to join us. I think they only have about seconds left. And Shiva, we can go ahead and go to the welcome back slide. Yeah, there we go. Actually, we can go one slide ahead if that's okay. Yep, right there. And as everyone comes back, they can also start to answer this. So we just wanted to know, everyone, there was a lot of information that, got shared today. Hey, everyone.
Hey.
I'm gonna put my good friend Natasha on blast right now. I was so heartbroken that we had to reschedule our date, but it's okay. I'll see you next week.
I apologize. I clearly owe you an edible arrangement or some coffee or.
Why don't you cancel on me so I can get an edible arrangement now?
Send one to the whole team.
All right, Joel, I know we've had a very full session. I know our breakout room was really fruitful. I hope yours was also. Another poll for today, which part of today's meeting was most valuable to you? The DHCS statewide policy updates, justice involved population of focus, coordinated entry education spotlight, journey mapping to identify targeted issues and solutions, PDSA planning to put solutions into action. Ooh, we did a lot.
I know.
We did a lot.
That was a lot.
Go ahead and answer that poll. Okay, so clearly updates were incredibly helpful. Really appreciate you taking the time to answer this because as we put together agendas, we really want to make sure that it's of service to what you all need. So I appreciate and we appreciate the feedback. Next slide. Next steps in 1 minute. Okay, very, very important. We've already referenced it today. I know you've received the email, but please fill out the experience survey by Friday the 30th. And if you participate in more than one collaborative, please fill out a separate evaluation for each collaborative. This is a really important way for us as your facilitators to receive feedback, to know what to continue, to know what to stop, and to know what recommendations you have. So thank you in advance for taking that time. Next slide. All right, so next month's session, July 24th, make sure you attend the party. Registration link will be coming. As homework, reminder to do the plan portion of your PDSA template. For pre-contracted folks, please review the resources at the end of the deck, and we will reach out to schedule a follow-up one-to-one conversation. Office hours, next one is July 20th from 1 to 2. Use the link to join the meeting. You can access all the slides and supplemental materials in the shared project folder. If you have any questions, please reach out to the amazing Shiva at Health Begins. And please spread the word with other stakeholders who you think would benefit from being in the room. Next slide. Hey, special thanks to everybody on this call. Really appreciate all the time you put into bringing the updates. Appreciate new people for attending, and look forward to being together next month. I hope you all have time to enjoy your favorite summer activities.
Bye, everyone.
Thank you.
Take care. Thank you.
Thank you. Have a great day.
Thanks.